Yes, a very warm welcome to you and thank you for joining us on Health and Wellness. It's such an amazing Sunday. Thank you for tuning in. And today the topic of discussion is all about breast cancer awareness. As you can see, it's Pink October. My feet is from the amazing Lugo collection. Find them on Instagram. They're also located at Muktadada Street. That is opposite Jivanji Garden. They do an amazing job when it comes to bespoke suits. So, tafuta Lugo collections, yeah? But today, as I talked about, as we were speaking, it's about breast cancer awareness. And joining me in studio is Daktari, Dr. Moki Mwendwa, who is an oncoplastic breast surgeon. Nimesema vizuri? Good. Karibu sana.
Asante.
And we also have a breast cancer survivor. She's called Sophia Makuva. We're so happy to have you on set. Karibu.
Thank you.
Yes, and I just want to go straight to it. Like, what does this month mean to you, Sophia?
For me, Breast Cancer Awareness Month, October, is very important to me.
Yeah.
It's a month of reflection, just being grateful to God that I have a new lease of life, that I survived breast cancer, and that it's a testimony that I am not, cancer is not a death sentence. When diagnosed early and treatment outcomes are better.
Wow.
Yes.
Me nimeenda straight kwa nywele. I love your hair. The photo that is on our poster, you are bald. Your hair looks amazing.
Thank you.
How long did it take to grow it back?
Of course, I lost the hair almost immediately after I began chemo.
Yeah.
By the time I was going back for the second chemo, that was 21 days later, I didn't have the hair. It had fallen. And after chemo, there was a span of 8 weeks. By the time I was going for my surgery, I had hair growing back.
Wow.
Yes.
You are lucky. And you're looking beautiful. We're
Thank
so
you.
great to have you
Thank you.
here on our show.
Thank you.
Sasa tunaweza anza show sasa vizuri because I was just it has to mean a lot to you.
Yes, it does.
Especially see kama hata venye sisi tunaiongea awareness I know it touches your heart in a special way.
Yes.
So I had to start with that. Karibu daktari.
Asante sana.
We're talking about breast cancer. Please just break it down. What is this thing?
Well, I think breast cancer, you can look at it as a disease that affects the breast.
Yeah.
Of course, it's malignancy, so to speak, if I may use some medical terms. So it's a cancer that affects the breast. We know that it's commoner in women than in men. Only probably 1 to sometimes up to 5% of breast cancer will occur in women, but it's
in women?
in men.
Yeah.
So mostly a disease of women.
Okay.
And worldwide, it's commoner as you age, probably up to the peaks at the 5th to 6th decade of life. And when you talk about cancer, again, you have to talk about things about there are several types of cancer, but what is most important, like Sophia has mentioned, is that we want it diagnosed early.
Yeah.
So what we can do to make this diagnosis early will be very useful, because at those moments, that's when you have more options of treatment, and then the cure rates are higher.
Wow.
So if we can advocate about it, talk about it more, so that people are aware and we are able to make an early diagnosis.
Yeah.
That's what we want to do, especially in October.
In October.
Yes.
Probably the causes, because yes, it's
Yeah.
going to get to women. But what really causes it?
Well, I think we get asked that a lot. But like most cancers, there's no specific cause for cancer, but there are risk factors. And when we talk about risk factors, again, they are population-based risk factors. So they're not risk factors that if you have not done this, you will get cancer. It's a risk factor that if you are in this particular subset of people, then the chances of getting breast cancer are higher. So when you talk about the the risks of breast cancer, we classify them as modifiable risk factors and not modifiable risk factors. Of course, non-modifiable risk factors, there's not much that you can do about. And then modifiable, there is something that you can do about.
Like what?
So now, you want me to delve into the modifiable ones?
Yes. What are these modifiable ones?
So the modifiable risk factors are like one, of course, lifestyle.
Okay.
Lifestyle that is probably sedentary lifestyle. So we need to get active. Drinking and smoking, that's about lifestyle. Healthy eating habits versus unhealthy eating habits, those are modifiable. Then there are a few other things that are actually modifiable, but it's debatable. So like if you have your first child a bit earlier in life versus the people who get a child later in life, the ones who have a child earlier in life have a lower risk of getting breast cancer. Then those who choose to breastfeed have a lower risk of breast cancer than those who choose not to breastfeed. Okay. Then there are a few other things like...
that is debatable. There are those who choose not to.
Yes, there are those who choose not to. Then things like contraception.
Yeah.
So those who have or use contraception versus those who don't use, especially hormonal contraception.
Are you serious?
Yes, but it is when you talk about contraception, again, we want to be not very hard, because we know that the benefits of using contraception outweigh the risks of probably cancer or any other adverse effects of contraception. So those are some of the modifiable risk factors. Then when we talk about the non-modifiable, then it's something like just being female.
Yeah.
That's a risk factor, but you can't do much about.
I know.
Age, as you advance in age, the higher the risk. Nothing much that you can do about. Yeah, so there are a good number of risk factors. I think I've just mentioned the ones that are coming top of my head.
Okay, and let's talk about diagnosis. Sophia, when were you diagnosed?
I was diagnosed in August 2021.
Yeah.
However, the way Dr. is talking about risk factors, I've never had anyone in our family in the long lineage with the risk factors. But he said that being female is risk factor enough.
Clearly.
So at the age of 19, that's when I think I got a risk factor. I'm a nurse by profession. And apparently in the class, during a session of self-breast examination, the tutor says, now teaching us, and so we were doing it practically in the class. And then I feel a lump on my breast.
All right.
At 19. And I started seeing a gynecologist, but then there were no breast specialists. So you see the gynae. So I was diagnosed at 39. Yeah. You get, so you do the math. It was long ago. So I've been on follow-up for adenofibroadenoma. That's what I was diagnosed with. Dr. will tell us what that is. And for the longest, and the doctor keeps telling you, this one is okay. Most teenagers have this. Most people have this. But being a nurse, now I was very cautious about it. So I had taken a bit of time before I went for a checkup. And then I decided one of the days I was on leave, let me go and just do the screening. Then I see a gynae again. And the first thing he does is an ultrasound. And he says, this lump looks bigger. Let me send you to a breast specialist. So he sent me to a breast specialist. And the breast specialist said, let's do a mammogram. And the mammogram was suspicious. And being a nurse, I'm following, and
you're aware.
I'm getting anxious. And he says, let's do a biopsy, just to be sure what we are dealing with. And the biopsy voila, stage 3B, breast cancer.
What?
On 24th of August. It's a date that can never leave my head, 2021.
How was it for you that day?
It was crushing.
Uh-huh.
Emotionally, it was. As much as I anticipated something is wrong, the diagnosis comes as a shock, total denial, and you're like, this can't happen to me. This can't happen to me. And unfortunately, before then, I had lost about 4 people in my family, different causes of death, of course, beginning with my mother, my grandmother. In a very short span, I had lost quite a number of people. And like now, you know, those are the first thoughts that come to you. I'm going to leave my kids soon. With who? They don't have a grandmother, not, you know.
Yeah.
So you begin thinking about the negative. But it is, I think it's just a normal process, normal thought process, because you begin with the denial, the shock, the bargaining, the anger, before you reach acceptance. And it doesn't come in a day.
Were you tempted to seek probably a second opinion?
No.
Ulichukulia hivyo. Kai.
Because I'm already in the field,
Yes.
sometimes you will know if something is fishy, you want to confirm. But I'm not saying that there's a problem, you going for a second opinion. If you feel that it's part of therapy, in terms of psychological therapy, because I started a WhatsApp support group, and those are some of the things that people bring up, and I tell them, it's fine, seek a second opinion if you feel you're not satisfied. And doctor will tell you, most of these doctors, they're the same.
I know.
in these hospitals around Kenya, around Nairobi, you'll find the same person, they'll do the same things, probably the same labs, you know. So I wasn't tempted.
Dr. and she's mentioned about certain stages of breast cancer types. So could you break it down to us?
So, yes, there are different types of cancer.
Yeah.
And of breast cancer specifically. But the bigger classification, you would say, we call them tumors. So they are tumors.
Okay.
So you can have a benign tumor, and you can have a malignant tumor. So the benign tumors, of course, they are the non-cancerous ones, like what she mentioned that she was diagnosed with before. So those ones, depending on certain characteristics, you don't always have to have them out. You can just have a follow-up. But sometimes, or many times, you might want them out, or it might be necessary to have the tumors out. But now, in terms of what we are calling the invasive tumors or the malignant tumors, there are several subtypes. And the commoner one, I don't know if it's okay to just mention, very medical terms. So the invasive...
But now you'll need to break it down.
Yeah. So I think it might probably be a bit more technical, but the commoner one is what we call invasive ductal carcinoma. So that is the commoner type. Then the second commoner is called invasive lobular carcinoma.
So how do they look like? Like the tumor, how big is it?
So it's not about the size.
Okay.
It's just about the fact that the cells have become uncontrolled in terms of their growth, and they grow faster than the normal cells. So because they're growing bigger than the way the body is able to control them, then they form a swelling. And it can be a small swelling, it can be a big swelling. Some grow quicker than others, some spread faster than others. When you talk about, so there are several subtypes of cancer. I think it will be a bit very technical. But once you have a cancer, the stage is about how far has this disease gone. Is it only localized to the breast? Has it gone to areas or regionally near the breast? Or has it gone distant away from the breast to other parts of the body? So that's when you talk about, stage 1,
stage 2,
stage 2, stage 3, stage 4. Now, stage 4 is when the disease is advanced.
Yeah.
It has gone beyond the breast and probably the armpit and the chest wall, which is the area that we are saying it's local, regional. And then at that stage is when we say the treatment is now not curative, it is becomes palliative treatment.
Okay. And that stage 3
Yes.
at Sophia's
Stage. Yes.
How is it looking like?
That still you treat with a curative intent.
Okay.
Yes. And because you asked her about the diagnosis, how was it?
Mm-hmm.
So when we're doing a diagnosis of breast cancer, what we say is a triple assessment. So there's, the presentation of the patient and examination. Then you do imaging. Mm-hmm. She mentioned she had an ultrasound first, then a mammogram. Those are probably the initial imaging for breast cancer. Then after that, you need a tissue sample, which is a biopsy.
Okay.
Then with that triple assessment, then you have a diagnosis. Then subsequent to that, you want to see, now how far has this disease gone? That's when you do staging. And staging is again by imaging. So there are different modalities of imaging depending on how the patient presents. And at each stage, then, and depending on the disease, then you have a conversation of how is this treatment going to be.
Okay.
And usually we want it done in a multidisciplinary approach. The treatment of breast cancer, and indeed all cancers, is not only for one person. It will not be an oncologist or a surgeon or probably a radiation oncologist. There's a lot more. You have the radiologist, you have the pathologist, you have the surgeon, the oncologist, the nurses, the oncology nurses, you have physiotherapists. It's a whole team approach.
Physiotherapists are there to do?
Oh, yes.
That has struck my attention.
So, because we know, even occupational therapists, because we know the treatment is going to have an impact on the body. And some functions of the body might not work as well as they should. And you want an involvement of a lot of people. So the physiotherapist specifically, once you have surgery to the breast, you could get what we call swelling of the lump, of the upper limb. It's called lymphedema. Then you'll want them to manage that. And before that happens, you actually anticipate it before it happens. And that's when you involve them, so that they help the patient prevent that from happening in terms of how to handle the hand, how to move the hand, whether compression is needed. If they need physically to do the exercises for them, then they do it. Advise them on how to use the limb, which on the breast side, which has been affected.
Okay.
Yes.
At stage 3, Sophia, what symptoms were you showcasing?
Just from the follow-ups I had previously.
Okay.
And usually when after my menses, I'll feel my breasts are very tense. And then I'll have lymph nodes in the armpit. So I used to that's the only thing I used to feel. But no pain, no pain, no discharge, no change of shape. That's why I always say that my only risk factor was being female, having breasts, and having a fibroadenoma.
That's it. So after that diagnosis, and what kind of solution or treatment options did you now start thinking of? Najua ilikuwa denial, you had to move to acceptance at some point. So from then on, how was the journey looking like?
I'll say that acceptance is a journey.
Yes.
And I'll use the example of grief and loss, or loss and grief.
Please do.
There's a particular staircase we've given grief and loss until we reach acceptance.
Yes.
But the truth is that it's zigzag. You think you've reached acceptance, then when you're alone and you're doing reflection, you are thinking, why me? You become angry, you bargain, should I go for this chemo? And in my initial years as a nurse, I nursed patients on chemo, and at some point, that time, the outcomes were not very good. Dr. If you can remember, Ukoma 2006 and 7, you nurse a patient, you think they are doing so well, then you'll hear they have died. Or they miss a chemo session, and when you ask about them, you are told they are normal. So such things made me, actually I left that employment at that time. Yes. What? So when I got diagnosed with breast cancer, it was like vicarious trauma. It just dawned on me, now it is my turn, it is me. And the reason why I left is I was ill prepared. I'm not an oncology nurse. And before then, I don't think there were many. So as a general nurse, you'll do everything. So I was ill prepared for that, and it affected me emotionally, psychologically. Had to look for another job. And I was candid enough to tell them that if you're employing me, I'm not going to work in a ward so-and-so.
Oh, no.
Yes, because it was causing me trauma. So at that particular point, I had to really come out of my denial so fast, because the knowledge I have is that if you hit this thing fast and aggressively, you will overcome. So I had to accept and begin the treatment journey. And the treatment journey, we started with the chemotherapy with my doctor. That is the discussion we had. We started with chemo. I did 6 sessions. After every 21 days, I'll do chemo if my blood works are okay. Because sometimes when the immunity is low, they have to carry forward. Okay. Because now chemo will take you more down. Then after chemotherapy, I stayed for 8 weeks before the surgery was done, mastectomy. That was done in February on 24th, coincidentally, because my diagnosis was on 24th August. So I had the surgery was done, total removal of the entire breast plus some lymph nodes. Okay. And
on the right side?
Yes, this side.
Okay.
Then after another 8 weeks, then radiation was done, 30 sessions, every single day except weekends. Yes.
It took a toll on you?
Yes, it did. It actually did. But I'm a strong-spirited person.
You look like...
By the grace of God, by the grace of God, I don't draw my strength from physical things. I draw my strength from God. And I believe spirituality works. Apart from just you having the knowledge and taking the steps, there's also that aspect of you seeking psychological and emotional therapy, and now spiritual therapy. And I became my greatest pastor.
What?
Because you speak to yourself.
Yes.
You speak to yourself first. Before that word is coming from your pastor, you have to have spoken to yourself for you to overcome. And when you come with negativity, I'm that straight person, I'll just tell you, no, not here. Yes. And that's how I fought all the way to so the active management ended in June 2022. Okay. And we began now the journey of tamoxifen, which is an oral, maybe Dr. will expand on that. Medication that I'm still on for the last now 3 years, consistently every day. Yes. Though the days I forget, I have what we call chemo brain. Especially when you change.
Like a mommy brain.
Yes, when you change your environment, you forget. And I travel a lot, so sometimes unapatanga kabag hakana.
Uli change bag ukasahau hapa. Oh no.
Now you know why I don't change my bag so often.
Hapo umejitetea Sophia lakini. Hapo umejitetea. Yeah, but so you've been cancer free for the last 3 years.
They usually tell us not to say we are cancer free. We are in remission.
And you let you okay. But remission.
Remission. Okay. But I believe I've been healthy, and I'm more healthier than most people I know.
You are.
I do my exercises.
Wow.
I eat healthy. I try and be as active as I can. Though kuna ile majera huwa inabaki, like now the way doctor is saying after the surgery, the hand is no longer the same. There are things I don't do with this hand.
Is it the one that you used to write?
Yes, I write with it. I still feel the numbness. I still feel some spasms at the back, especially when I have to make a sudden movement. So and you learn to live. You learn to live with it.
You let us know more about that and how the journey has been. We just want to take a short commercial break. Remember, I'm still here with Dr. Moki and Sophia. The topic of discussion is breast cancer awareness, and our social media handles at @KTN_home_, at Ali_Zaitun, and on the WhatsApp line, in case you have any questions for Daktari, for Sophia, 0759 434389, 0759 434389. This is Health and Wellness. Stay tuned. We're coming right back.
StarTime's home solar solution with solar panels, hybrid inverter, and lithium battery, empowering you to do the things that really matter. A complete and reliable home solar solution. Call us today. StarTime Solar. Power your life.
Finish kumalo. Round this tuna finish kumalo. Tuna finish kumalo. Kubash to life tuna malo. Tuna finish kumalo. Kwa Yesu kuna bamba. Nilimdigi kwa shene kwetu kubamba. Usipambane sana. I'm real. Jumia meni bamba. We. Kubamba. Kubash. Skule vina bamba. Kubash. Kubamba. Kubash. Skule vina bamba.
Great yummy taste, gotta hack it. I spread bread, but in go gotta pack it. Napaka nyweki design ya mogoro. Blue band, Juni natural cocoa. 5 vitamins, una grow plus ni tam nani Tuna hack snack na ki blue band choco for your growth.
Imagine, haiwezi live in 50 different movements. Makofi to both babies and Morphix. Renewed Morphix, ultimate quality.
Your entertainment is always on. With DSTV Stream, anywhere it's on. Thrilling sports action, captivating novellas, authentic local series, late time for kids, unmissable reality, and much more.
Are you ready to party?
It's all on with DSTV Stream. Plus, it's already included in your subscription. And all you have to do is download the app and get your stream on. Anywhere.
This weekend on KTN Home. KTN Home, your home of entertainment.
StarTime's home solar solution with solar panels, hybrid inverter, and lithium battery, empowering you to do the things that really matter. A complete and reliable home solar solution. Call us today. StarTime Solar. empower your life.
Wear it pink because together we fight. Pink means strength. Don't wait. Get checked. Early detection is your superpower. I am a warrior. I beat cancer, and so can you. Let's dance for awareness. Let's wear pink for a cure.
We are stronger together.
Every ribbon, every voice counts. October 18th, wear it pink.
Let's end breast cancer.
Together.
More than just a couple times.
Breast cancer only happens to
It can affect any one of us.
Anyone. Most people diagnosed have no family history. I am an example.
Let's stop the stigma.
Treatment is tough, but I am tougher.
With support, we can fight harder.
Stand up, speak out,
and support.
Together! Funny how the heart can be deceiving.
Oh, wow. Welcome back to Health and Wellness. My name is Zaitun Ali, and the topic of discussion is breast cancer awareness. That is a campaign that we did together with my colleagues, producers, TV hosts right here at KTN Home. We're just marking this month. It is Pink October. Pink means strength, you guys. And today we just want to create awareness about breast cancer. I know we are warriors and we'll beat it. We will. Karibuni sana. Still in studio, I have Dr. Moki and Sophia. Dr. Moki is a surgeon, breast cancer surgeon, and Sophia is also a survivor of the same. Umeniambia nisiseme ati cancer free. You know, guys, I'm learning. Umeniambia tunasema tuko in remission. Ni remission?
Yes.
Okay, sawa sawa. And you've mentioned a couple of treatment processes that you had to go through. And Dr. I just want you to expound more on that. What are the treatment options that we have to beat this breast cancer?
Well, so we, like I mentioned earlier,
yes,
the disease itself is a bit vast, and for every patient there are different characteristics. And that's why I mentioned also that when you are making a treatment path or a treatment plan for a patient, it's an individualized treatment.
Okay.
So that's why you involve everybody, so that you put everything into place and have a specific treatment plan for each patient. But in general, you have 4 modes of treatment for breast cancer. So there's surgery, there's chemotherapy, there's radiotherapy, then there's targeted treatment, what we would call targeted treatment. But the targeted treatment is mostly endocrine treatment or hormonal treatment. The first 2, which is surgery and chemotherapy, can alternate. So some people will require chemotherapy first, and other people will require surgery first. So either of them can come first. Then subsequent to that, there are those who will require radiotherapy. Then there are those who will require the targeted treatment. Different cancers will require different forms of chemotherapy. So for those who will require chemotherapy, there'll be specific form of chemotherapy for each cancer, but there's a general way of that you would say that the patients with breast cancer would go in terms of chemotherapy. Then again, when it comes to surgery, then we also have options. You have options of where you have, and for surgery, you always have to have surgery in the breast and surgery in the armpit to get some lymph nodes. All right.
Okay.
So, and in the breast, you might need to get the whole breast out, or you might need to have what is called breast conservation surgery, where you're just removing where the cancer is with an area of normal tissue. Then in the armpit as well, you might need to do a bit more extensive surgery or a smaller surgery into the armpit to get a fewer number of lymph nodes. But this again depends on the stage. For most patients who will get what we would say upfront surgery, that means you are getting surgery before chemotherapy, there might be the option of getting the breast conservation option. And for all patients who will get the breast conservation, we know that we will need to do radiotherapy. All patients who will get breast conservation will need to get radiotherapy. Okay. Some of the patients
she didn't get radiotherapy?
She did get radiotherapy, but for some of the patients who will have the breast out might not need radiation therapy. If the breast cancer presents very early and you have done surgery and it is a small cancer and the rest of the characteristics of the cancer are not very aggressive, some of these patients, a few proportion might not need chemotherapy. So not every patient will need each form of treatment.
Okay.
And each treatment follows the other. So you will have surgery, then chemotherapy, then radiotherapy, then the endocrine therapy or the hormonal treatment. So each will follow each other in sequence.
Okay. What? And we're talking about how it's the treatment options are affecting day-to-day activities.
They definitely do.
So she has mentioned a couple of things that she's been feeling, muscle spasms. They're called spasms. Yeah. What else can one experience?
So really, each patient will have their own different path.
Okay.
And different effects at each stage of treatment. And also, different patients experience the effects differently. Sure. Like I might feel pain, and you feel pain, but your pain is different from my pain.
Yeah.
So there are many other factors that affect. But if I could talk about specifically surgery, which is now my area.
Please do.
So there's of course, for those who will lose breasts, there's the psychosocial aspect of it because of the femininity, the loss of the femininity. Then you might have pain either over the chest wall or the scar, the armpit. You might have limited movement of the shoulder. You might get shoulder pains. Like I had mentioned about swelling of the upper limb. We call it lymphedema.
Okay.
And so those are some of the effects of the longer term kind of effects of the surgery. There might be a bit of immediate effects that you have in the immediate time post surgery. The one thing that, like you mentioned earlier, that people really fear about treatment for breast cancer is hair loss because you get chemotherapy.
Yeah.
So that is always a major concern for many. I mentioned about the loss of the breast itself and its effect in terms of the femininity, but we know that apart from what I called breast conservation surgery, we also have options of breast reconstruction, whether in the immediate, phase or as a delayed procedure.
Okay.
So the reconstruction can be done at the same time as the surgery for cancer is being done, or it can also be done at a later stage.
Okay.
Apart from reconstruction, we also have prosthesis.
Which one is that?
A prosthesis is, like a filling or a mold that you would put in the bra, so that socially it will appear
as normal.
As normal.
Okay, that's an option. And actually, you guys you're from Kilele Health, right?
Yes.
Yeah. There's a time it was last year's Pink October, you actually came with the samples of the same. They're available for people?
Yes.
Yeah.
Like for me, I opted for a prosthesis.
Okay.
And the way doctor is saying, the surgery comes with a lot of self-image things. There are things you touch on a woman, is like you touch their femininity.
That is true.
Touch the hair, touch the breast, touch the nails. That's why I don't groom my nails, because there was a time they were just very black and they were getting off by themselves.
Okay.
So when I look at them, is a way of just appreciating God that I can have hard nails that are not brittle as they were.
Yeah.
So for the prosthesis, the one Kilele showed last year.
Yes.
I call it temporary because it's not everybody who will afford the silicone one.
That is true.
So it's good because, like, when you look at me, before I tell you I had a breast surgery, you won't know because
you can't.
I have a prosthesis.
You can't. You're making me want to look sorry.
Yeah, when I tell people, they now want to look. It's something I've gotten used to.
Sorry.
So there's the temporary one, which is just woven and mostly is done by cancer survivors.
Yeah.
Woven, then you put some fiber in it, but it's usually very light. If you touch your normal breast, is not as light. So sometimes it keeps shifting.
So you
and no, in the initial stage before the radiotherapy, I was using that. Then there was a time during the radiotherapy, you're not supposed to even wear the bra. So it's part of the self-image issues that, you know, and you can't stay home because, again, your psychotherapy has to happen.
So during the whole radiotherapy session, like during the session itself, or when
during
you're
that
undergoing
period,
that whole period?
Yes, because you can't mess with the site.
Okay.
It is very, it chips off very quickly if you wash it with aggression, with soaps, detergents that are very strong, you don't oil, you know. So you have to really take good care of yourself. And for the silicone, is a bit expensive. Not every person can afford. I mean, in the groups, and people will say, you know. So if you can, one of the things I tell people, if you want to support someone with breast cancer, there are people who, the fruits are good, but there are things that will cover that deficit for them. Wigs are very expensive. You're a lady and you know that.
Yes, very.
If you buy this person a wig, they will appreciate you.
Oh.
I never used to use wigs myself. I only knew they're expensive the time now I needed them. And I had friends.
But you are looking really good. Just a point to note. That picture on the poster, really, you're looking really good. You are rocking the bulbs very well with confidence.
It is a friend, a colleague who said, no, before this hair grows back, let me take you to the studio. It's part of the support.
Wow.
And
you did a photo shoot at that time.
Yes, I did.
And you've mentioned about support groups, actually. And this Kilele Health that we're talking about is one of the support groups for breast cancer survivors.
Yes.
Probably talk about your experience with support groups and how they actually shaped your life and your lifestyle even after the diagnosis.
One thing I've discovered with the support groups is that you really need to wait until someone is ready. Because we have people with diverse experiences. And we have different personalities. There are people who interpret very good news, but in a very negative way. There are people, maybe someone is just saying that my hair has come off, but I'm grateful I am alive. You know, this is someone who is very positive.
Yes.
Someone else seeing that message will interpret, oh, so with my first chemo, I'm going to lose my hair. You know, that's a different personality altogether. So personally, I didn't want to join a support group in my active phase of treatment.
Yeah.
I never joined any. I was afraid because sometimes you hear someone, amekufa, you know, I was afraid of those bad news. And even when I was doing the chemotherapy, I used to request the nurse, please don't schedule me on a day you have very sick patients.
Oh, yeah.
You know, because you look at that person and you feel, and the way doctor is saying that people will respond differently to treatment.
True.
Personally, I never had an issue with vomiting.
Okay.
I had nausea, but I didn't have vomiting. And I knew how to manage that. there are people who are being treated currently the same way with the same medications, but they are vomiting and vomiting, you know. So you can't say that nowadays people don't vomit. So people just respond differently to treatment. So the support group, until someone is ready, they can join.
Yeah.
When after the treatment, and I'm a social media person, have a lot of presence on social media everywhere.
What's your handle?
I'm on Facebook as Sophie Simon, and Wisdom and Life. Then I'm on Twitter as Wisdom and Life. I'm on TikTok, Wisdom and Life. Instagram, Sophie Simon. And I also have a YouTube channel at Wisdom Life. That is my handle. And why I began now talking about it.
Exactly.
1 year later on, when I'm okay, some people are even getting shocked. This
was happening to you.
But it was a way of defense, trying to guard yourself, because you also don't want those people who come to bring you down. You don't want those people who come to discourage you. And again, I think 844 taught us so much about IQ, and it left things like emotional intelligence,
life skills.
So someone comes to see you and they begin telling you a story about their grandmother who had, and I mean, this is not the story I want to hear right now. I want to hear the story of life. So kind of I shelved myself, protected myself from such stories. Even TV, I never used to watch things that will bring me down. I was very intentional on what I wanted to come into me. So I only began like a year later, when I'm okay, have some strength. You know, even that time when you are on chemo, you can't even type things on. You are very weak. You are very weak.
Oh, no.
Your hand gets tired. I remember, and this support groups is not just about the WhatsApp groups.
Yes.
It's even at work. Like I used to get a friend, colleague, who will drive me home after work, because again, you don't want to stay in the house. So that is support enough. You needed that, because like now your bones are aching. When you're driving home, especially when there is jam, and in this country we have jam in Nairobi.
Traffic everywhere.
You're braking, and sometimes you have to remain on that pedal for some time. Your leg is aching. So you will want someone to just make it easy. Family. Yes. I had an uncle who took me for all my sessions. I didn't want my husband to do that, because we had an 11-year-old and a 6-year-old that we needed to. So one of us had to be sober.
Oh, no.
One of us had to be sober. So it was a way of
going through all this and still having to be that mom, that wife, that colleague, that sister. Honestly, support is really important.
Yes.
Hence now the wisdom.
Sophia means wisdom.
Sophia means wisdom.
And life is just my experience with life.
To speak life into yourself.
Yes. My experience with life, and just inspiring hope.
Okay.
Inspiring hope with my journey and my experience, and educating at the same time, because also being a nurse, there's something I can tell someone that will educate them.
Oh, that's amazing.
Yes.
Daktari, tukimaliza show, probably talk about prevention and advocacy upon all this.
Yeah, so I think in terms of prevention, we had talked about modifiable risk factors.
Exactly, yeah.
So I think it's, just especially what we can do more is a bit more active life. Then, like issues of, we mentioned, drinking, alcohol and smoking. So the things that you can modify.
Change your lifestyle.
Change healthy lifestyle, healthy eating habits.
Okay.
But again, what has been proven to save many is early diagnosis.
Yes.
So for the right age group, start your, medical examinations. At the age of 40 and above, start getting your annual mammograms and annual medical checks. And
self-examination?
breast examination is very important from way early in life, starting even from as early as 25 years. And usually the self-breast examination that we talk about is not every day, really. It's regular self-breast examination.
Yeah.
And this regular self-breast examination involves looking.
Just
then
looking?
Feeling. So you look for anything that looks abnormal, probably on a mirror.
Okay.
Anything that looks abnormal. And any
shape,
difference, between the two.
One bigger, the other one probably smaller.
That's not an issue because that happens a lot. But is it looking more different?
Okay.
Because if you look more frequently, again, you'll get used to how everyone
supposed to look like.
So,
and if there's a change or a difference.
So you look, then you feel, and if you feel anything different, then you know you need to seek medical attention.
So
if
the
you
lumps.
see any, especially lumps. So when we are feeling, we're feeling for lumps, we are feeling for different architecture or different feeling of the breasts, areas that are lumpy more than others. And when we are looking for things to do with skin changes, prominent blood vessels, color changes, deviation of part of the breast itself, such aspects.
Okay.
So, self-breast examination, early screening.
Great. Thank you so much, Daktari. Thank you so much. Now I'm calling you Sophie Simon. Sophie Simon, asante sana for sharing your story and inspiring us and also instilling hope to a person out there. So at least you've told them where they can find you. Just tell them a message of hope as we wind up, as we close the show.
Cancer is not a death sentence. Cancer is treatable, and early diagnosis is what we are championing for. It will yield to better treatment outcomes. And this month, personally, I have said it is not just a hashtag. Let us go beyond the hashtag. It is your life. And it's not about 40 and above. I was diagnosed at 39.
Wow.
Yes.
We can beat this. Thank you so much for tuning in to Health and Wellness. This topic has touched my heart in a way that I cannot even express, and we're here to support all those that are going through it. Kilele Health, also thank you for supporting the cancer survivors as well, and Daktari also for creating awareness and even being active in the treatment process and the surgery. We are very grateful. Find this episode on YouTube immediately after it has aired at KTN Home, on our socials at KTN Home. My name is Zaitun Ali, and also go and find a logo collection on Instagram if you want to look dapper just like me. Until next weekend, see you. Thank you for joining and for tuning into Health and Wellness. My name is Zaitun Ali. See ya.